you're looking for lecture on ethics and legality, this is the one you want to watch. Designed to make this topic easy. 15 questions, just straightforward question to warm you up. Then we spend time going through the lecture detail, giving you facts you need to know, followed by 10 hard questions to get you in shape for your test. Stick around and let's practice some NCLEX questions on legality, a lecture followed by a question. Welcome to ADAPT NCLEX. First question, straightforward question to warm you up. How should the nurse respond? A nurse is orienting new graduate to a busy unit. The new graduate asks the nurse about what? The law, this is key, the law that governs how personal health of the client are used and disclosed. Your health, things about you, how it's used and disclosed. What is the problem? How do you do that? What do you think? ANA, this is what design your code. Nurse's code, right? Code of ethics is a collection of codes that determine how you act. Of course, this is what determine how your personal health record are used and disclosed. The Bill of Rights is your innate design being that is given to you from our Lord above. So this is what usually given to you, so nobody can take it away from you. Your innate rights that is associated with you being a human being, basically. And therefore, HIPAA is the right one. Number 2, which of the following regulation outline the information being discussed? Which regulation? So this test, this kind of ethic and law, pay attention to words. It's all words. Which of the following is a regulation outline the information being disclosed? The nurse is orienting new graduate on client's rights. Pay attention. Client rights when receiving care in the healthcare setting. Sometimes they will just define anything for you. When you're receiving care in the healthcare setting, what should define your right? HIPAA does not define your right. It just deals with how we can disclose your medical records, right? The Self-Determined Act deal with the fact that we have to ask you whether you have advanced directives. The emergency and medical treatment and active labor deals with the fact that when you show up in the emergency room, and even if you don't have insurance, we have to treat you. Patient care partnership is the documents they give it to you. They outline your rights while you're receiving. So the patient who show up in the hospital, they are designed to receive patient care partnership information, which is all the documents. You regulate your regulation and your right when you're receiving care. So it's this one. What is the best action by the nurse? A male client was admitted for pneumonia, buzzword. The wife, who is a charge nurse, right? In another floor, came to the client floor and asked the caring nurse for the client hard copy chart for review. What is the situation? Or the question is asking you, another nurse, charge nurse, who said is the wife of the client, came and said from another floor, hey, I need the hard copy of my husband so that I can review it. What do you think? What do you think? I can assure you we are taking good care of it. Negative. I need permission from the provider. You don't need permission from the provider. There's somebody there you should go get a permission from HIPAA, right? I need power of attorney document as a proof. You don't need power of attorney as a document as a proof. The guy is in the room. Go ask him. I need consent from your husband. Yes. So that's what we need. Straightforward. That's a principle that you have to know. Number 4. Same thing. This test is a concept. If you get the concept, you see that questions are easy, especially ethical and legal issue. Which statement indicates correct understanding of the teaching? A client with decompensated heart failure received teaching about advanced directive. Advanced, you do it ahead. That direct people, that's what it means. I do it ahead, directing people from the nurse. What do you think? Which one indicates correct understanding? I will need my PCM to witness my document. The PCM does not witness it at all. I need a surrogate to execute my living will. The living will is what it is, a living will. So a document that is living, basically telling people what they do when you are not capable. You don't need to direct anybody. The will itself is a living. That's why we call it living will. It's a document that is alive. It speaks for itself. So you don't need a surrogate. I would need a power of attorney to sign my advance directives. The power of attorney is the one you give a copy of the advance directive. They should not sign it. It may be falsified, right? I will indicate DNR status in my living will. Yeah, this is what you write in to tell them this is what I want to be done. So this is correct understanding. Number 4. Number 5. What is the best action by the nurse? A unit nurse gave a wrong dose to a client 2 minutes ago. I give you a drug, a wrong dose, right? What would you do? Should you file incident report? Well, the patient get the wrong dose. It may be overdose. Risk management, the patient get the wrong dose. It may be overdose. Assess the client, yes. See the effect of the drug on the client. Notify the child nurse. Patient is in a room dying from the overdose. Go and assess them first before you start doing all these things. It does not matter. Number 6, same strategy I'm using. What ethical principle is being demonstrated by the new nurse? A new graduate nurse gave the wrong dose for a drug to a client 2 minutes ago. The new graduate told the client about it. What ethical principle? I did something wrong and I told you about it. Fidelity is not that, right? That's not that. You're being truthful and loyal, but that is not the situation yet. You know that this is not beneficence or non-beneficence because it does not make sense. You are not doing harm or doing good, but it has nothing to do with the patient. You tell the truth even though it hurts. This is it. This is you keep your promise. Okay. Sometimes some people put truth there, but I always use promise and I say you faithful and you keep your promise. Veracity, you basically telling the actual truth, whether it hurts anybody or not. You take responsibility and tell the patient that, hey, this is the issue. And I'm telling you, whether you like it or not, you don't like it, but I'm telling you the truth. I'm not hiding anything. So that's that. The client fell and sustained. So a nurse is caring for a client with what? Severe Alzheimer's disease. The nurse left the bed in a high position, both rails down and without a sealer. The client fell and sustained a subdural hematoma requiring immediate evacuation. How will you classify this? Basically, you have a patient who is like severe dementia, okay? Alzheimer's, bad. And you left him bed up, nobody there, all the side rails are down, fell, bad injury. What do you think? You never touch the patient, it can be bad. You never force imprison them. You don't put a place that they don't want to. Malpractice is a secondary to a negligence, a professional negligence. So you did not do standard of care management. That is what negligence, in simple terms, things that anybody, a prudent patient in your standard, same skills would do, you failed to do that. So you were negligent. So that is the issue. A nurse is orienting a new graduate to a busy world about incident reporting. Which of the following the nurse should include? What should you include in incident report or example of incident report? When the client falls, it's a form of an incident report. Tampering with medical record, yes. Client elopement, yes. Adverse event during treatment, you got to include it. Physical abuse, yeah, you got to report it so that we can have a record of it and we can make sure this never happen again. These are all things that are examples of things you have to know for incident reporting. Number 9. Which of the following tort the LPN is committing? A nurse overheard an LPN telling a client during reinforcement teaching on incentive spirometer usage that I will put the mouthpiece myself into your mouth if you don't practice it 10 times an hour. Oh, that's strong, man. What do you think is happening? You have not invaded a client privacy. No. You are not forced imprisonment. You're not putting them in a place that they don't want to be. You verbally threaten them. This is it. You never touch the client. You see what I'm using? One single word every time. Don't make the thing so difficult. One word for each term. These ethics and legality is all words. One word. To assert somebody is all verbal. Never touched. He said, I won't do this. He said, you saying what you planning what you want to do. When you touch the client, you committed the boundary, but never touch the client. So it's not a boundary. Number 10. The nurse is referring to what term? The same thing, like I told you. You see, we keep on repeating just single words. A nurse is holding a media conference for a new graduate. The nurse discusses the liability with the performance of duties in a specific role for each member of the nursing team. Liability with the performance of duty in a specific role for each member of the nursing team. The nurse is referring to what? What are you referring to? Advocacy, basically, you're just advocating for yourself and the client, especially. Client is number 1. You, the nurse, you have authority to delegate and assign duties to your LPN and the UAP, right? When you do that, when they accept that responsibility, they accept that duty you've given to them, they have responsibility to make sure that job is complete. You will be accountable that if they don't do that, but they have a responsibility to make sure that task they have accepted, you have delegated, is performed. So the liability, and if something happens, they are liable for that. So the liability with the performance of that duty in a specific role for each member is a responsibility. When you accepted a job, a task from the nurse, you have assumed responsibility and you are liable to that. The nurse may be accountable, but you are the one who's liable. A new graduate about client confidentiality. Which of the following situation the nurse should include as a violation? Selected apply. A nurse give admission diagnosis to a client family member. Red flag there, right? Red flag. You can't do that without patient consent. A nurse allow family member to read the medical record. Bad. Without a patient consent. A nurse discusses client status to another nurse on different ward. Bad. A nurse share client status to incoming nurse during change of shift. Yeah, if I'm taking care of the client now, I'm coming in. Yeah, you can share those information with me. So that's good. That's the 1, 2, 3 are violations. Number 12. What is the nurse best action? A client with DNR order is intubated in the ICU for respiratory failure. The monitor alarm went off due to VFib. That changes to asystole. The wife pushes the code card in the room and said to the nurse, please do something. What is the nurse best action? Follow instruction. Patient has an order. Do not resuscitate. It went to VFib and asystole. Now wife want to bring him back. Good luck with that. Okay, no need to call a code. Don't begin quality CPR on the client wishes. Defibrillator is not needed. Number 13. 3-year-old present to the pediatric clinic with laceration to the left hand, oozing blood. Okay. The nurse suspects child abuse. What is the nurse best action? Child abuse, nurse best action is all safety for the client first. Safety is your priority. Notify the doctor is not important. Apply pressure to the wound. The thing is bleeding. Okay, pressure, dress it, assess the patient, and take some information and dress it. Report it to the manager. The client needs safety. This does not provide safety. Call the police. All these things are important, but number one, your priority, the best action, the thing is oozing. Put some gauze on it. This request may constitute what? A spar of a client with new diagnosis, brain tumor, told the nurse not to disclose the new diagnosis to the client. What do you think is happening if you honor this request? Okay, somebody has brain diagnosis, tumor, and you don't want to tell the patient. Malpractice is not. It's usually malpractice is negligence by profession. There's no, nothing's been filed in court or anything like that becoming malpractice, right? Violation of fidelity. You always know fidelity is faithful and following the truth, but this is not a situation that it does not apply here. You know, you're being faithful and following truth and staying loyal. You're keeping your promise. That's why I like the promise. Promise make it easy. It has no promise the client anything, so there's no need in it. Negligence, yeah. If you hold the truth, lack of communication about patient condition to anybody, especially the healthcare team, the doctor, the patient itself, you can be charged with negligence. So that's negligence. You are not invading their privacy. So know that if you hold information from the client, it can be considered as a negligence. That's not standard of care. 15. A nurse was teaching a client about procedure informed consent and which element must be included. Which item indicate correct understanding of the teaching? Select all that apply. Alternative procedure. Yes, you need to tell the patient that there's another procedure that can save their life. Risks and benefit of what you're going to do. What is the indication of the surgery you're going to do? You have to describe to them in medical terms. No, they are not medical folks, layman terms. So this is not included. Okay. Expected outcome. Yeah, what is going to happen when I let you cut me? Okay, so 1, 2, 3, 5 are your right answer. You don't need to discuss it in medical terms. Simple, so that they can understand. We don't want medical jargons. And this is the first 15 questions. And we'll move on to the lecture with details about all the things we've talked about. Then we do another 10 question set. Okay. So we'll start with ethics. I will try to make it easy and straightforward so that you can understand it. All ethics means is what? These are straightforward. Basically, your actions and decisions is being designed or controlled by some basics of belief and fact. Okay, you have some codes that determine those actions and decisions. That's all. So process of making some decision wrong or right by these actions is controlled by certain codes that you have within you. It can be made up of your morals and your values. And these all come together. This is what you held. It guides your behavior and then help you make a certain decisions and relating to stuff. There's some terms that usually come in your test. If you make a decision, okay, you make a decision based on the greatest good of the people, okay? Because basically you're making this decision that is going to help everybody, not individual, not affecting the individual, but everybody. You're acting using ethical standard of utilitarian. That's all. That's what it means. You're making that decision based on that. If you make the decision based on some obligation, decision based on an obligation or some duty and right or wrong that you have, then you're doing deontological thinking, okay? Deontological thinking of ethics. There's one weird one where it's all based on your moral character. If you make decision is based on your moral character, then you are being virtue in ethics. Like I said, I'll try to make it simple. So these are some few ethical terms you should go with. When you practicing medicine, as we saw in the question, there's some ethical codes and thinking that you should have as you take care of the patient. It's all related to the patient. It's autonomy. Let the patient be who they are, okay? Let them have opinion and make all the decision. So let client makes all decisions without coercion. Basically, you are not basically forcing them to do anything. Let them do their own thing. If they don't want any treatment, educate them, but leave the final decision to them. When you're doing that, you're being an advocacy of the client and let the clients do their thing and do their thing. So you protect their client rights, their health and safety. So all you're doing, you're protecting their health and safety and rights so that they can make whatever decision they want to make. If the client condition changes, you continue to do that. Then, as you continue to help, let them do their autonomy, you advocate for them, you have to be faithful and truthful. But I don't like the word faithful and truthful because it's very confusing. It interferes with veracity. Fidelity, to me, is just keeping your promise. As a nurse, he called you, he said he have pain. You say, I'm going to call the doctor. You go back and you call the doctor, you bring the pain medication, you treat them. If you don't come back, you leave. Tomorrow when you come, you've committed ethical standard that is on fidelity failed. You failed them. You do not keep your promise that you'll be there. If they're about to die, you said, I will be there and hold your hands. You know, you are not there, you failed them. That's fidelity. That's the way I make it. Keeping promise, I think, is more better than faithful and truthful. Okay? And then, as you take care of them, you have to do this no matter what your ethics standards, your morals, your actions. Race should not interfere with that. Gender should not interfere with that. Okay? Their socio-economic status should not interfere with that. So, equal rights. Afford them their bill of rights. Whatever they have, afford them. And don't judge them based on the color of their skin or the content of their whole being. So that is the key. When you're doing that, what are you doing? You are doing good for the patient. You see something wrong, you call the doctor. Doing good. Something wrong, you call. They need physical therapy, you call. That's what you're doing. When you know they're going to have a procedure without a consent, what do? You intervene. And what have you done? You've done this. Okay? malfeasance, normal feasance. Basically, that is what you've done. You doing no harm. You know they don't have a consent, you don't allow the doctor to operate on them. You know they not be consented, you make sure they get a consent. You know that they're intoxicated, they cannot get a consent, to find somebody to consent them. You know they already get a sedation, so the doctor cannot consent, you intervene and to let the charge nurse know. That's what you're doing no harm for the patient because you are being good. So that's the way it flows. And then my favorite is veracity, where people worry about this, but it's very important. You are just being what? Truthful and honest. And what does that mean? Use this one for your test. You tell the truth, even if upsetting and distressing for the client. You give them wrong drug, you come back, I give you wrong drug. You're not going to die. You may have a side effect. Hey, but we got to watch you. Your safety is my thing. I'm telling you, I can't hide that. And when you're doing that, what are you doing? Accountability. Accountability. That means what? You are accepting all responsibility for your action. That is what you've done. You're taking accountability. Whatever happened, whatever wrong I did, I will tell you the truth. If it's going to cause a problem, I'm still taking it. You are not worried about it, what will happen, and so you start hiding it. No. In the end, what is this boiling into? We don't want you to be this guy. Parentalism. Parentalism. Basically what? It's opposite of autonomy. Okay? You just basically acting like their father or their mother. I don't want you to be my father or my mother. And you're removing all right. They can make any decision for themselves. And this is the way I want you to think about ethical responsibility. This is the way I want you to think about it. There's a few one that you have to pay attention to. And that's what I said. We saw a question on it. Responsibility. People get confused about it. It's not accountability. You have authority to delegate. Authority has been given to you to delegate. So you delegate and you can make a judgment about what you need to delegate. When you delegate, whoever accepts that delegation task, now they have what? Responsibility to make it happen. So that's the question we saw. The liability of making sure that whatever associated with that tax is done is on them. And that is responsibility. Okay. You still have accountability for delegating that job. So you still have to check and make sure the person who accepted the responsibility for that tax is getting it done. And this is ethics 101. I hope you understand it. So let's continue. So we're going to start with informed consent. Like I said, I'm trying to make it straightforward as much as possible. So I put them together in such a way that it's going to be acceptable to you, things that are familiar before the hard ones. But there's keywords you have to pay attention to, of course. This is required for any procedure. If you don't do that, you commit some violation. Okay, it's a tort violation. If you don't do that, then that is battery. You touch the patient with their permission. So this is why we obtain informed consent, to avoid battery, right? What is the problem? The whole thing is on the surgeon. What does the surgeon need to do? Explain risks and benefit of the procedure, right? What does he need to do? Provide some alternatives for the patient. Need to let me know the outcome of the procedure you're going to do, the complication of that specific procedure, the surgical procedure, the detail in layman's terms, so that I can understand what is going to happen. The indication. Why are you doing this? Well, you have colon cancer, so I need to take your colon right away. This is what is going to, the benefit you're going to get. You don't die from it. All those things is very, very important. What need to happen? Client. Condition. What need to happen? You have to be competent, not under any influence. Key. So you are not, have no alcohol on board, no drugs on board. What I mean drug is like sedatives. You're not taking anything. So all those things has to be narcotic, and it should not be coerced. Like, you can force me to do that. We got to meet all those standards. It should be voluntary from the patient. The client must understand what you're saying. Once again, in layman language, not jargons. I don't want jargons. We're going to do cholecystectomy. We're going to put the laparoscopy, remove the gallbladder through infestoral incision, excise the costal margin. Who cares? Those are gibberish for the patient. I put the camera in, I see the gallbladder, I remove it. They don't need to know all these scientific words. They don't need. So if you see a question like that, all the jargons, no, take them. I don't pick that answer. It's a violation. Keywords. Client can rescind this consent anytime. Even 2 seconds before you get the patient to the operating room, they can rescind. He said, I don't want this. Let me go away. You should let them go away. Otherwise, you committed what? Battery, like I said. What is your role? You, the nurse. Nurse role. This is what's the problem. They like asking you, what is your role? You don't have to do anything. Witness the consent. You are not liable to anything. The consent, your witness, your signature means what? Patient understand the risks and benefit, and has no any other question. They understand what they signing. That's all. It does not mean that you signing, it means you telling them to have surgery. No, you're witnessing the fact that they understand the risks and benefit. They don't have any more questions for the doctor. They don't have any more questions. They're competent. You verify. That's what your signature means. That's all. Signature means they understand the risks and benefits. They have no more question. Patient is competent, and he was not coerced. Let me put it there. And it's not under any influence of anything. Influence of drug, narcotic, basically, or sedative, or alcohol, basically. So those are the keys that you got to put it together. There's way they can trap you. If they ask you a question specific to the surgery, well, call the surgeon or the procedure, right? Call the surgeon, whoever is going to perform the procedure. If they ask you something about general knowledge, yeah, something about patient care, oh, yes, provide the usual nursing teaching, pre-op, post-op, and intra-op questions. Yeah, that's basically general, okay? But you know the teaching, what will be there, nurses, but you're not going to tell them how they're going to do the procedure specific to the surgery. Yeah. If they ask you what diet they're going to eat, and yeah, you can't say call the surgeon. No, you should know that. Post-op, these are simple, it's not related to the surgery, it's outside the surgery. So don't say, I don't know. You should go talk to the doctor, specific to the surgery. That is the key. So I would like to separate it. Situation that the patient cannot sign. Okay, patient can't sign consent. It's when they, like I said, under influence. I want to say it multiple times so that you can stick. Okay, they are incompetent. They can do that. Yeah, they can do that. Or they are unconscious. Who can sign for them? Their power of attorney, proxy, if they are available. So those are the situations they can sign. Surrogate, anybody, they can sign if they are available, if you can reach them. Okay? These also can come out. You cannot modify the consent after signature. So can't modify after signature. If you need to say after the patient sign, if you need to change anything, so if this is the patient, if this is a word, maybe you said cholecystectomy, and you want to cancel this, you can't do this like that. All you need to do, cholecystectomy, just draw a line in, write whatever you want to write on top so that everybody will know. That is what we mean by modification. Any changes, you draw a line through it so that everybody can see what is under. And so that in the future, we know you never hide and scribble things. Another key fact, cannot what? Obtain consent after the procedure. You go back to normal one. If you do that, you committed what? Battery. You touch them without their consent. So you cannot do that. In few situations, people can sign for another client, like I mentioned. Sign for the client if they cannot do that. So parent of a minor can sign for the minor. Okay. Legal guardian can sign consent for their guardian. If you are court appointed, you can also sign. If you're a client, power of attorney, client, power of attorney, yeah, you can sign. Or the proxy, yeah, you can sign. If nobody, yeah, then it's closest relative or spouse can do that. But these people have more priority than the last person legally. There is some exception in terms of consent. They always bring it. So exception to consent. Emergency care. If you come in, anybody who need emergency care, if treatment can be delayed, then the patient can die, yeah, we have to make certain changes. Okay. In emergency care, if there's nobody who is available, and then we have to operate really fast, we have something we call implied consent. So if you come in with the subarachnoid hemorrhage, severe headache, epidural hematoma, that if we, or maybe aortic AA rupture, and you comatose, and we can get a consent from you, the doctor will take you to surgery without a consent. This is what we call implied consent. That means they doing in your best interest. They know if you are available and you are awake, you are not comatose, you will let me operate on you. That is what it means, implied consent. So this patient, in terms of emergency, and the patient is not available to consent, and it's a bad, look at the thing. They are bad injury, not just a single, just a fracture in your leg. Yeah, we can wait and find somebody. This one, time is our essence. If we don't operate on you, you are in trouble. So that one, they can go to surgery without consent. Emancipated, okay, minor. What does that mean? If you're less than 18 years old by state law, okay, and you married, you good, you sign for yourself. If you're serving in the military, yeah, if you have to go and you can get killed, yeah, then you can sign consent for yourself. You married less than 18, you are in the military, okay, and you are a parent less than 18, right? You are financially independent from your parent, you are good. You can sign consent for yourself. Less than 18, you married, military, parent, you have baby, financially independent, you can sign for consent for yourself. Specific, you see, I'm breaking it down. Specific situation too. If you need sexually transmitted infection treatment, yeah, you can sign consent. You don't need your parent consent. If you're looking for contraception and you are less than 18, you don't need your parent consent. If you have you need mental health treatment, you don't need your parent consent, and you are less than 18, all of them. If it's a substance abuse treatment, you are less than 18, you don't need your parent consent. That's how the group. Another key fact, I'll put a star there. Parents cannot refuse care, life-saving care for their kids. Jehovah's Witness parents said, don't give blood to my son who need blood, and if you don't get blood, he's going to die. We will say no, negative. Okay, negative to that, daddy. We're going to call the ethics, okay, people from the hospital. They will go and get a court order, get a protective custody, for somebody to take care of the kid, and then we will treat the patient. We don't want the kid to die because you said you're a Jehovah's Witness and you don't want blood. No. So that one, if patient need appendicitis, if you don't do it, they're going to die. And the parent said, no, I don't want it. Yeah, we call and we go through this process so that we can take care of it. Otherwise, the kid die. Your parents cannot make that decision. It's a life and death problem. You don't want them to do that. This is the interesting one. Competent adult. These people have all the rights they can have. They're not drugged, they're not intoxicated, they can make a decision, They can have heart attack, MI. They can have triple A rupture. They can have subarachnoid hemorrhage. They can have what? Gunshot wound to the belly, GSW. If they said, leave me alone, I'm leaving, refusing treatment, please let them leave. Otherwise, force imprisonment. So let them leave. They are competent. They have bad injury. They sound normal. Let them go because according to the law, they can make a decision. They are not under the influence of anything. So they can decide to leave against medical advice. And this is leaded to what? AMA. Basically. So that is the way it goes, the flow. They can leave wherever they live. So, what is AMA? You can make this decision to be able to satisfy for this. You have to be competent. What else? You have no legal, that means there's no legal problem against you that will prevent you. We put you in the hospital because we asked the judge to bring you to the hospital. But if you don't have that situation, yeah. And then you are not suicidal. You're not going to kill yourself. You're not going to kill somebody. Homicidal. You're not going to kill somebody. And can take care of yourself. So self-care. All these conditions, these people, they can leave AMA. Self-care. They don't kill anybody. They are not homicidal. They are not suicidal. They have no legal oath. And they're competent. Competent. They can do whatever they want to do. What should you do? Educate them about what is going to happen when they leave. Or you can say educate them about why they should stay. I think you should stay because you have severe problem. You're going to die on the street. I don't want you to die. So educate them about it. And so what are your actions? Next actions for somebody who want to leave AMA. Number one, assess their competency. Make sure they're competent. So how do you do that? Neuro checks. Simple neuro checks. Where you are, what is the problem, what is your name? If they can give you, you've done good neuro check, it doesn't have to be expensive, but simple one, yeah, you've cleared them of the problem, right? Then you know they're competent. Then you discuss with them about the risks of refusal. There is informed consent, then there is informed refusal. So informed refusal, let them know about it. Informed refusal. So you tell them the risks of leaving. When you're going to have surgery, we do the risks of getting the surgery and the complication of it. Same thing, the risks of leaving, this is what will happen. Give it to them. If still they say no, notify your doctor. Okay, let the doctor know that this is what is happening so that they are aware about it. Okay, let the doctor know. If they say no, then let them sign the AMA form. Give it to them and sign. They may refuse. They will refuse. Don't block the door. That if you don't sign, you're not going to leave. That's imprisonment still. They want to leave. I know they need to sign the AMA, but they can still refuse to sign it. Don't block the door. If you block the door, it's forced imprisonment. all you need to do, say, fine, you can leave. Just make sure you remove all IV or tubes from the patient. Don't call the security, don't call them. And just document in the chat. About refusal to sign the AMA form. That's all. You've done your job. That is all you need. You've done your job. There's some situation where we have to keep these patients. Well, that's what we call involuntary admission. I briefly said it. I said it, but I just want to put it under this involuntary admission in case you see that you will not get confused. These people are admitted due to self-harm. They want to harm themselves. They're trying to commit suicide or harm somebody else. So homicidal or lack of self-care, like schizophrenic patient, catatonic symptoms, they can't do anything. So you have to keep them. We have to admit them to the hospital and then take care of them. The key is this: despite involuntary admission, they still have all the rights afforded them. Every right they have not lose it. So don't go and put IV in right away. Don't go and do things you're not supposed to do. If you go and put the IV in, they say no, and you force them, you commit battery. So they still have the right of refusal. So they can refuse, it's different, refuse treatment. So I've been admitted, but still refuse treatment. They can do that. You cannot restrain them. You can't. You can't put them in seclusion. No. You can't do that. They still have all the rights. If they have a mail coming, you can't open it. If they have food from somewhere, can't throw it away. Because you worry there may be some drugs in it. Give them all the necessary information that they need. You still treat them like normal person. If you need to give them medication and they're refusing, you go back to the court and get an order from the court, and then you can do other stuff from it. But that's the key. You don't do anything that is not like, hey, they are involuntary admission, so you just want to like treat them like somebody else. You can't do that. And this is informed consent, detailed information that you need to know about this process. Okay. Okay, what is the next we have? Now, let's talk about thoughts. This is very, very important. We saw a bunch of it in the question, and so we're going to see how it play a role in management of patients that we see. It's very, very important, and I want you to pay attention very carefully. It's very, very important topic you need to know. So, what is thought? I'd say lawsuit. Okay, semi-lawsuit and the bigger lawsuit. That's the way I see it. So the way I see it in the layman term, lawsuit, but it's not true lawsuit. It's something that has happened. Okay, that you can be sued for it, but we don't use the word lawsuit, right? So in layman term, in the simplest formula, is an act by you, the nurse, or licensed provider. Okay, somebody who is licensed professional, basically, that led to what? Liability claim. So somebody file a claim and say, yeah, I need some money because your treatment make me broke my leg. Well, the accuser need to show that. Accuser is the burden of is the one that has to show the burden of. You have to prove it. Okay, so all the burden is on the accuser to provide what damages happen. So they have to prove that the damages occur. Basically, that's the easy way to say it. Okay, so that is all I thought is. It's just basically somebody file a claim and then they try to make it difficult, but in actual fact, it's a form of mini lawsuit, in the medical professional terms. It can be 2 or 3. I like the 3 form of tort. So I thought I'll call it 3, and I was explaining why. Okay. The intentional, that first, let's do unintentional. You don't thinking about it. It wasn't like planned, okay? As the name say, versus quasi intentional, then intentional. These are the 3 things, the act that you can perform that will lead to somebody to file a liability claim. That's all. An act performed by the nurse that led to liability claim. So it can be intentional, non-intentional, or quasi-intentional, right? So let's do the unintentional, which that's the most common one we all have. I mean, we all get into trouble. Unintentional talk. First one is negligence, and we saw the question already, and then this is the easy one. And the way to understand it is, I call it standard of care. What is standard of care? It's a care that will be rendered by anybody. So anybody that have the same skills of like you, same intelligence or similar, same foresight, okay, same judgment. You see the word is the same. In that situation, will perform a duty that you fail to perform. So perform a duty that you fail to do. So that is standard of care. And they use the word, if you look at it in the text, they will say reasonable and prudent. These are lawyer words. What is a reasonable and prudent individual means the individual has the same intelligence, foresight, judgment, and skills as a nurse. In that situation that happened, they will do something different according to the standard of care. But you fail to do that. When you fail to do that, you have what has happened is you negligent to that particular act. So, what are example? All it means is you failure to follow standard of care. That's all. Set by your ANA. Okay, standard of care. Fail to do that. And how does that mean? You do not report critical life value. That is easy. Everybody will do that, right? You have equipment, you never use it properly. So improper use of equipment. That's why you go under orientation to learn how to do IV, all those things, how to pull IV. You pull IV and the patient had a embolism. Yeah, negligence. So you have to use the proper way to do that. You saw something, failure to communicate. You not communicate. And I told you about hiding diagnosis. It falls here. If you hide the patient diagnosis from them because the family member said, yeah, don't do that, you committed negligence. So you can use that against you. Those are the keys. You fail to act as an advocate for the client can also be considered as a negligence. You fail to document, negligent. Fail to assess, negligent. You fail to monitor. You see what I'm doing? That's standard of care. This is what you do as a nurse. So if you fail all this information, then we have a problem. And that's how the negligence comes. That's the definition. You fail to do certain things that anybody in your standard will do that. Therefore, how do you avoid this? Well, follow standard of care. Communicate with people. If you see something, provide competent care. That's how you can avoid being negligent, right? You do all the things, you document, you assess, see something, you intervene. That's why your test is all about intervention, intervention, intervention. You see something, you say something. That's what it means. I see something, I say something. Intervene and evaluate if you need to make a change. That is what negligence. It's not that difficult. It's straightforward. The key is if they take you to, they file this claim, they have to prove. I told you they have to prove those damages. There's elements they need to prove negligence. In this year, I want you to pay attention. There's elements to prove negligence, right? First, number one, how do you do that? You have to duty to provide standard of care. So duty to provide standard of care. That means you, the nurse, you have the duty to provide standard of care. So let's take it an example. Okay, let's take this as an example. And I want us to take it, let me put it here. So elements to prove negligence. So one, duty to provide standard of care. Example, patient coming, admission. You know what you're supposed to do, pressure injury check. So you got to calculate the breathing score. You never did it, right? So you did not perform pressure injury assessment, right? You never did it. That's the duty, that's standard of care for every hospital. On admission, I've seen this in my own eye. Patient coming, this was never done. 2 days later, we see a big sacral wound. Even though probably the patient bring the sacral D-cube from home. Most of them are bedridden. They have it already. But nobody checked to figure out if they have sacral D-cube already. Now, 2 days, they have unstageable. What do you think? Negligence. They will say, you failed to do that. And this is what the lawyer will say. Duty to provide standard of care. You never do your assessment. You don't know their breathing score. And so you don't know it. Number two, you breach that duty. You have the duty to do that, and you breach the duty. What does that mean? The nurse, you did not perform what? You did not perform pressure injury assessment at admission. So did not perform PE, pressure injury assessment. Basically, you did not do that. This is the third one that become a problem. Some people, sometimes it can be difficult. This is foreseeability. That means you like a prophet. You can see ahead. Foreseeability. That is like what a lawyer word, basically. All it means is one and two, combine them and see. you know that you should do pressure injury assessment. If you do it, you will take certain precaution. But now you do not do it, you never took the precaution you're supposed to take because you never calculated the grading score, right? That's all what it means. So failure, you should know that failure to do the assessment, the failure to do the assessment will cause the harm, will let them develop pressure injury. If you fail to do that, that's foreseeability. That's what it means. And then the 4 is just combining 2 and 3. Breach of duty has potential to cause harm. That means, since you did not do the assessment, you know that you never provided the precaution that is needed to prevent the injury. So this, I usually say, is all precaution. Because you fail to do the assessment, and you know not doing the assessment can cause the injury, you never took the precaution. And the last one is basically the harm, okay, basically he reached the patient. That's all. So this is what the lawyer will do to prove that you have violated the client, you've committed the negligence. And these are the 5 things that need to be proved. Duty to provide standard of care, you breach that duty. There's a possibility of that. If you do that, you breach the duty as a potential of causing harm, and then you cause the harm. Those are the things that need to be included. These are first intentional tort. Okay, so that's that one, negligence. Then the second one basically is an example. It just like sometimes it can be very confusing. It can be very, very confusing, but the way I see it is straightforward. They call it malpractice. I call it, you did something bad because you're a nurse. That's all. A profession gets sued. That's all. You get sued because you're a profession, a doctor, nurse, LPN, anybody who will be licensed professional gets sued. That's all in the court of law. That's the malpractice. That's all. That's what it means. Because you're a registered nurse, so the other way you can call it negligence, you committed negligence by profession. So you are a professional and you commit negligence by profession. It's malpractice. You did something illegally that caused harm to the patient, but who did it is a nurse. If a janitor did it, probably they'll call it different. That's why they call it lawsuit in the other category. But when they come to medicine, they use the word malpractice. It's a professional getting sued by that. And there's few of them. Okay, there's few of them. So a few of them. Example is straightforward. Malpractice. You fail to check the patient drug, and then you give it the drug to them, the dose, and you cause some harm to them. You have committed a malpractice, right? You fail to check the dose. You give it to the patient, and you cause harm to the patient. That's key. The key word is it causes injury. That's what is going to happen. So that's one of them. That's like key. There's a word also used here, abandonment. This is also can be considered part of the malpractice. You can get a malpractice claim for that. Basically, use the desertion, basically, of the client. You deserting them. If you take responsibility of a patient, after taking responsibility, if you assume responsibility of a patient, you cannot just desert the patient. You can't just leave them and say, oh, I'm going. Yeah, somebody should take care of it. You got to pass on to another person. This is why we do change of shift. So you can tell me what happened, patient condition, and I can take care of it. You cannot give it to RPN or somebody that is not supposed to be the primary person, somebody with the same skills as you who can take care of the patient. So you have to make sure you don't desert your patient or you don't abandon. You can lose your license for that. So those are some of the key things when you see it in the test, you should pay attention to that. So those are the unintentional thoughts that you can see. The intentional one, as the name say, you want to do it. So intentional thoughts. Now call it, there's two, the two main one, okay? There's two main one. Attracting you, right? And I carry it out. That's all. I'll give you a threat and then I carry it out. So what is that? If I threat you, I'm assaulting you. And this can be verbal, mostly emotional. So I'll tell you things. I say, hey, if you don't stop what you're doing, I was going to shove the thing in your mouth. That's an assault. I'm threatening you. But I never touch you. I never shove the thing into your mouth. Okay? Client refused medication and you said, if you don't take it, I'm going to shove it in your mouth. You still has not touched them. Okay, you have not touched them. So that's the saying, the spoken words, it's just the assault. So that's the threat you give it to them. If you physically take the medication, shove it in their mouth, put the med even though they said no, and they are competent, you committed badly. So you carry out your what? The assault. The things you plan to do, you finally carry out. Like I told you, somebody want to leave AMA and you block the door. You put them in restraint. You refuse to let them leave. All these things is a problem. And you touch them, okay? You have touching them. You touch them, you've committed battery. But then in general, that changes its name. So I just want to use that one. If you don't touch them, it's easy. You've not committed anything. Talking about things is an assault. Okay. Battery is when you touch them. Then when you block the door, you committed another crime. So there's a bunch of crime. Okay. So I just put this there to give you some idea. You see the flow. So I talk about it. Okay. Talking and threatening you. I'm assaulting you. Right? If you don't do this, I will do this to you. If I touch you, I've committed battery. If I prevent you from leaving, What have I committed? False imprisonment. So that is the third one. So there's two. There's three. So this is the first one. The second one is battery. If I touch you, and if I don't let you leave, I put false imprisonment. You can commit false imprisonment and battery at the same time. If you hold the patient, you've touched them. You have committed battery. And if you don't, the idea of you not let them leave, you committed false imprisonment. So we'll look at the question and see what they're trying to tell you. So you can commit battery and false imprisonment at the same time if you hold the patient down and then you don't let them leave, touching them without their consent if they said no. So those are all three intentional torts that you can be liable for. So willful intentional act, that's the thing. You think about it and you did it. Willful and intentional act is the intentional tort. So the willful and intentional act, that's the definition. And then, so you intentionally threaten the patient, you committed an assault. You touch the patient with that act that you plan to do, yeah, battery. And then if you don't put them in places you don't want, if you restrain the patient without their will, so restrain, you put them in seclusion, you block the door, you're not touching them, you're just blocking the door, that's just imprisonment. But if you physically hold them down and all those things, and you have to hold them, yeah, you also committed battery in addition to that. So those are the three things you should pay attention to in terms of intentional. Like I said, I divide it into quasi. I call it quasi because the other ones are not that dangerous. They are not that dangerous, but they're also bad. Okay, so I call them quasi intentional. You thought about it, thoughts. And these people don't pay attention to that, but it can be, okay? It's invasion of patient privacy. And you intentionally, this violates the client HIPAA, basically. When you do that, it gets intentional. You intentionally did that. But sometimes because you don't planning, you don't know what you're doing. So that's why you created that. So invade the patient privacy can be, it's a form of intention, but it's not. That's why I call it quasi intentional. Defamation of your character. Basically, you're making insulting remark, rude, you're teasing the patient, you're doing the client or your fellow worker. Okay, this can involve the client, the worker, but mostly workers, people you work with, your colleagues. Basically, you say things about them, you write things about them, you defaming their character. They can sue you. It happens all the time on the newspaper. They call it regular lawsuit, we call it tort because it's a professional. So when you talk about them, and either in the written form or in the verbal form, that's what is happening. Their reputation. So there's two. Okay. If you write it down, like you write something down, L, right? Write something down. This is written. You write it down. That is libel. That means it's a form of defamation of character, but in we classify as libel, right? Especially if you post in Facebook or Instagram, or you write it in the nursing station on the board. You say, hey, your colleague, this he has a HIV, even though it's not true. It's falsify information. That's the key. It's not true. It's things about them that is not true. You tell them the patient is what? Hate so and so, even though they don't hate so and so. You say things about them that is not true. and you post it, and then they get mad. That's defamation of character. If you speak it, spoken, yes, speaking, that is what, and so spoken, that means slander. That's what we call slander. So you slander somebody, is you gossip, basically. You tell untruth things about them, yeah, without not being written. And the way I remember them is straightforward. If there's a record of it, record, hard copy, record, yeah, that is what libel. If there's no hard copy, then it just was spoken, unless it was recorded. But if there's no hard copy, yeah, so no hard copy, and somebody heard it, yeah, that's considered slander. You slander the person. All these things, if you don't take care of it, I know we do that. We talk about people all the time and gossip. Just make sure they don't hear about it. These are tort claim they can use against you because it's defaming their character. And so you have to know about it. Intentional tort. Okay. So those are some of the information you need to know, and you have to distinguish between quasi intentional and non-intentional torts. Okay. Let's continue. So HIPAA, everybody knows this, but there's some few principles that you have to know. All it governs is your medical records. So it governs distribution of your medical records, and how we can disclose your basically things about you to other people. It's all about disclosure of your medical records. It's very, very important because there's so many violations. Your blood work, your diagnosis, your treatment against your medical consent. The hospital cannot do that, or co-workers cannot do that. Okay, very, very important. All he's asking is just make sure you don't disclose things about me so that anybody who get the information will know who I am. I have clients as the sole authority about what you do with their medical record, even though it's not in their possession. In their possession right now. They can request for it, and they should get it in timely fashion. Okay, and you cannot disclose anything without their consent. There's few exceptions. We'll talk about it. Okay, if you have to disclose, okay, just make sure minimum amount of information as possible. Like need to know stuff, need to know basis. The transporter for a patient who's going to get a CT scan does not need to know that the patient has a pancreatitis. That's why we're doing it. Just take the patient to CT for me. That's all. They don't need to know. The janitor does not need to know that the patient is going to have cholecystectomy tomorrow, so the room should be clean. Very, very key. Need to know information. This is where people get into trouble. Brother, sister, wife, husband, still have no right to look into the patient medical record. Whether they work in the hospital or not, that's no matter. Whether they are the charge nurse or not, that's no matter. Whether the hospital they own the hospital in charge. No, they cannot touch any record, even if they are husband and wife or whatever. They can do that. When you're in the cafeteria, the hallway, in the elevator, please don't talk about them. Just make sure don't talk about those stuff. Don't post things in social media. You're violating HIPAA. Don't put it in the newspaper. No, nothing. You shouldn't not do that. Don't take your report to their house. Don't do that. That's against you violating the HIPAA. Don't take their chat to their house. No, because you want to finish your reporting. No. You don't share your password to anybody. No. Just make sure you remove your ID in nowadays with computer. Yeah, you should do that. The medical team, yeah, they can know stuff about the patient, but need to know basis. Not everybody should know details. So that is the key about HIPAA. That's all. You just have to know you're disclosing enough information. A patient who is in seclusion, the police came to arrest them. Police does not know that they have brain cancer. They don't need to know. That's violation of the client privacy. You don't need to tell them. Just minimum amount of information as possible that will not tell them who the client is. That is the key. And you, the nurse, you have to report a breach. When you see it, say something. I keep on saying it. There's some few exception. Insurance also, they cannot, okay, the hospital can send your information for insurance purposes, but they cannot disclose information to workers comp. Okay, like you're trying to get a leave, workers come, they cannot get your information. You have to give it to them. But the hospital can use your information for claim. That one is fine. There's nothing wrong with that. So those are the key stuff about HIPAA. Basically, another exception is like if you're suicidal, you're going to kill somebody. I got to disclose the information. I'm homicidal, yeah. And if you're abusing somebody, yeah, I got to do that. These are the three biggest that we can violate your privacy in order to ensure the individual is also not in trouble. So, suicide, homicidal if you're abusing somebody. There is a situation though. Every place is not waterproof. You know, sometimes we have private room, semi-private room that you can unintentionally disclose information about a client. The law says you are allowed to disclose those information not intentionally, but if you take reasonable precaution and somebody heard about client information, this is not violation. So you talk about a patient, but you take reasonable precaution not to let it go anywhere. But even when you do that, somebody heard about it, it's not what? Violation. This is no violation. What does that mean? I don't go and stand in the nursing station. I keep on screaming about the patient name. Everybody can hear it. I go someplace, I talk about it. But if somebody heard it in this secluded place where we are allowed to talk and heard it, yeah, I make necessary precaution to not to spread it, but somebody heard it. This let me give you an example so that you can understand. What you can do, you like if you're in a semi-private room, you use some curtains or dividers to divide two clients. But when you talk about one, the other one can hear it. But you've done that. You've done that such that you've made that effort to prevent information spread. You can't block the air from going to the patient. There's no way. If I'm talking to the patient, yeah, the roommate can hear it. But still, at least you make the necessary precaution by using the curtain and the divider. You try not to do it and speak about a client in public space. You hear that's another. You've done it. You're taking precaution not to do it. Okay. Third one, you can just list the client last name. It's okay. Listing their last name on the whiteboard in the next station. It's okay. This is allowed. You've taken some precaution. If you want to place a communicating information board, put it in a place that is not visible to the public. Even though it has some client information on it, it's not visible to the public, so that's fine. When you are in a semi-private room, just lower your voice. That's why, in addition to the divider. And then the sixth one is if your roommate, okay, has some airborne infection, or not airborne, droplet or something, like if they're on precaution, you can tell the roommates, hey, wear a mask, okay, so that you don't get affected. But you don't have to tell them, no need to tell them about diagnosis. Like you show up in the emergency room and all the people here has cold, the nurse can tell you, hey, you need to wear a mask so that you don't get infected. But you don't tell that so and so has pneumonia or so and so. So you don't disclose those information to them. So that's the some of the things you allow to do that in terms of HIPAA that cannot violate it. So those are the non-violators basically. So that's that information. Advanced directives. This one, I try to make it easy, straightforward as much as possible. Advanced directive, ahead, plan ahead. That's all. That's the way I call it. You plan ahead so that in case something happens or there's something to do, everybody have know what to do. Basically, there's two types. It's a living will versus the power of attorney. So that's the POA, right? Power of attorney, or the healthcare proxy. You have to know the difference because the board will ask you. The living will, as I was describing, is a paper that is living. The paper is living. It can talk for you and is living. It has life in it. It can talk. So you tell them everything, write everything. It's a legal document. Okay. And you tell them exactly what you want. There's no flexibility for the people who have the will. This is what I want. These are the life-saving things. Nobody should touch me. Nobody should do anything. Usually signed and witnessed. The doctor or nurse are not involved. You know, witness anything. They are not. This is mostly life-saving stuff. And what to do, like CPR, intubation, feeding, terminal cancer, basically, if I need to be fed, organ donation. It can also involve tissue donation, all those things, comfort care. You're basically telling them what to do in that situation. Keywords can be revoked. You can revoke it anytime you want, either verbal or in written. No exception. There is no designation. You don't designate anybody. No surrogate. Designated individual. You don't have that. That is the key. There's nobody like that to do anything. You've already said anything. You don't appoint anybody. You decide what you want in life-saving technique. We need to have this. If the doctor writes an order, there's few things you need to do with the nurse. You make sure there is documentation in the chart before you can execute those orders. So if the nurse say, the question say, there was an order in the chat saying do not resuscitate. Well, the next thing you ask is, where is the documentation from the, so you call the doctor and say, you need to verify documentation that this was discussed with the patient and then family member. So that is very, very important. You got to verify it. You don't need the will in the chart, just documentation. This is regarding an order for DNR. You don't need to have the will in the chart specifically. If the doctor write an order, you don't need to. All you need to verify, this has been discussed with the parent, with the patient and the family, and this is how they want to proceed. And then you can honor it. But if you don't have the documentation, you cannot honor it. The other difference is power of attorney. It's a proxy. And as you can see, I give you all power to make only medical decision, nothing else. No financial problem, nothing like that. So this is flexible. Only medical decision. They're acting as the best interest as much as possible. That's what you expect them to act. Best interest of you. They don't do anything. You can choose multiple proxies. They need to have copies of the power of attorney document. Okay, they need to have a copy of it, the advance directives, signature, POA does not sign, power of attorney, the nurse, doctor does not sign, witness your consent or anything like that. They are not involved at all, but they need to have a copy, and you can resend it anytime. You keep it in safe place. You don't need to notarize it. People always talk about this. No need to notarize it. That's all. You don't need. All you need is 2 witnesses. And it does not include the nurse, the power of attorneys, any of them. You see what I've done? They ask a bunch of questions. They want to know if you understand this language. It's just, oh, look at the answer choices and you pick the right answer and you'll be good. So this is power of attorney and then living will. I would like to add something. At the end of life, people changes. You don't want to eat, no eating. You have anorexia. This is good because they see death. So don't force them to eat. Don't put 2 feeds or feeding tube in them to feed them. They're going to lose small. To feed them. It's okay. It's adaptation to have anorexia in times of death, right? They get forced and everything. You've tried to feed them. They do all procedures in this patient that is not going to prolong their life. It's just not happy. What do you do in this situation? There's few things you, the nurse, can do to improve the anorexia. Just oral care, okay? Meal from the family. Let them bring food from the home. You can give them stimulant. The one we use is Menges. Another name is Begestrol. And this can basically improve the client appetite and they would like to eat. That's all. If they start having death spell or death rattle spell, they're making like noise, rattling noise when breathing. All you need to give them is like anticholinergic. It's because of their secretion. So give them anticholinergic. See the answer choice. If there's anticholinergics like atropine, scopolamine, this will prevent them from having excessive secretion. That will help with their situation. So that is all. Let's discuss some legality issue. This is raw but straightforward. Okay, there's some federal influence on the nursing practice. So federal influence, nursing practice. And what are those? We saw HIPAA violation. It's a federal law. Okay, the next one is the patient, which we also saw in the question, Self-Determination Act, which is what? PSDA. All this is you have to inquire about, ask client about the advanced directives. And if they don't have one, make a provision so that they can get one. Give them all the information that they need. This is a federal law. It's a requirement for every hospital. Then we also saw this EMTALA in a question. Basically, it's emergency medical treatment and active labor, basically. That means you're going to stabilize any patient, whether they have insurance or no, if they present to the emergency room. Whether they have PLAS or manuals insurance, it does not matter. You got to fix them first before you start talking about money. So those are federal laws you're supposed to know. Okay. Of course, the bulk of your practice, so the bulk are all influenced by the state law. So that one, wherever state you are in, you got to figure out. And so the state designates certain few, designate some areas for you to be influenced through your nursing association. Some of the associations And so the core nursing practice usually is regulated by the state law. That's what it means. And then they define your parameters of your nursing practice. So they define parameters of nursing practice. So they are the one who define how far you can go, what you can do, and what you cannot do. How do they do that? They give authority to the state, the nursing board, basically. So they define, they're basically representative of the state. And so when you are in a state, the law look the same. The laws are similar. Okay, they are very similar. But wherever you are, you got to figure out to make sure there's no big difference. What is their main function? They can revoke, suspend, and then reinstate, give you new license, basically, to practice. It's very, very important. And what did they look for? You can get into trouble by revoking, suspending all this information if you practice without a license. No. It's a problem. If you're involved in substance abuse, you are in trouble. If you are convicted of a felony, you are in trouble. Negligence, professional negligence, like we saw, which is a malpractice, right? Negligence. If you provide care beyond what is being stated, your scope of practice, you are in trouble. So that's what they do. The state board, which is given by the nursing board, who has been given authority by the state board, control all these things. Okay, and so key thing is they set the standard for you. They set the standard for nursing programs too, and how they should train you, and then the scope for your practice, or scope of practice for all registered nurses. And some of the LPN and the PNs, they set all the scopes. So the state board usually they are the one that involved through the nursing board, basically, that they representing them. Okay, so that's the key. So we saw standard of care when we were doing negligence and malpractice. Talk about the fact that you have to do something that a prudent and a reasonable individual should do with the same qualification. So those are very key information that you should start thinking, right? So those are the standard they're looking for. Okay, and these standards form part of your scope of practice. Okay, where can you find it? You know where to go. Nursing Practice Act. So what is the Nursing Practice Act? This is basically give you a standard of your scope of practice, what you need supposed to do. And it contain all those information. So if you need information about your scope of practice and how you should perform standard of care, yeah, the Nursing Practice Act is where you should go. And within that book, it directs you, it tells you things that you can refuse. I put in capital. You can refuse to practice, okay, beyond your scope of practice, as indicated in that manual, okay, in that act. It can say you can do that. You can do that, okay? You can refuse to practice beyond your scope. So if they give you an assignment out of your competency level, okay, and they want you to take it because there was a staffing issue. Okay, there's a lack of appropriate personnel. Yeah, you can refuse because it's beyond your scope of practice. Something you cannot do, like putting in a central line. All those things is beyond your scope of practice. So you can tell them, no, I can't do that. This is against my scope of practice. The most important, you can't just make a problem for the person. All you need to go do is follow your chain of command. Basically, report to your immediate supervisor, say, I'm assigned to this. This is beyond my scope of practice. I can't do that. And then the issue will be taken care of. But you cannot desert the patient or anything like that. That is key. Okay, so that's those information. Now, who published those information? It's very good to know this information and those standards. Because even for your test, after your test in your practice, you have to know that who published those standards of nursing practice, the Nursing Act. Okay, who does that? So it's the American Nurses Association. They are the one who published that act, the Nursing Act, which is that determine your scope of practice. These are the people who publish it, but they get help from other people. Okay, the National Association of Practical Nurse Education Services and Services. They also help with that. Then they also get help from specialization groups, organization. I know there's nurses who are critical care nurses, stoma nurses, okay, oncology nurses. All these people also contribute the book and it helps establish it. Okay. The few things I'm going to say is about yourself. If you start working, it's for your exams, but you need to know the health care facility and procedures. Wherever you work, you have to know this. Healthcare facility and procedures that you have to follow. This information, it contains policies, okay, policies and procedures you need to follow in case of emergency. It has established standard, okay? Established standards for your practice of, okay, in that institution. And it usually mirror that of the Nursing Act, basically. So it's the same thing, but it mirror that. But every hospital has the healthcare facility and procedures, which are policies and procedures, how you should behave, okay, in case of emergency. Is very, very important. It gives you detailed information on how you should provide care. Provide care in certain situations. Very, very important. Very, very important. So this manual you have to know. Like how you pull IV, okay, how you put the IV in, how long the IV should stay in, what kind of discharge instructions you should, procedures you should follow when you're discharging patient. All those things are within that manual. So you want to find that manual. Listen to this, what I'm going to say. And this, you will love it. This is the key. If you practice, okay, if you practice according to the in the policies, these policies indicated in the healthcare facility and procedures, you are legally, okay, protected. Even if the standard of care results in an injury, Okay, if the standard results in an injury. What it means is if you follow the instruction in that manner and you did it, you follow it to the T, and even if something happened to the patient, you are legally safe. The hospital will be responsible, not you. It's very, very important. Because if they file a complaint, if they file a legal complaint to the nursing board and they check and they said, oh, you follow institutional policy to the T, well, you are protected. This is key. So when you go and start working, follow that. Pay attention to that. It's very, very important. So my advice in your test or when you're working, follow assessment procedures that the hospital have, post-op procedures that they have, how to take care of it, when to change the IV, how to flush saline, how to lock it, how to pull central line. All these things are very, very important because if you don't follow it and something happens, they will tell you this is not how you told to do things. Just some few things I'm going to add it to malpractice insurance. If something happened in terms of malpractice, okay. Most of the time, malpractice is filed as a civil tort, okay. And when the court find you guilty, then you have to give a restitution. That means you got to pay something, right? That is the problem. And it's very good for a nurse to carry sometimes personal malpractice insurance. If you have money, because of that, to provide for this situation. In terms of restitution, if there's restitution issue, okay, rarely would they file a criminal problem or anything like that. So how do you prevent all these things? I've said it multiple times. Practice within, this is an advice, practice within the provision indicated in the Nursing Practice Act. Okay, follow the ANA codes of ethics. Okay, just follow it. The code of ethics that you already know. And treat every patient equal. Make sure you maintain your skills. Recognize your strength and your weakness so that you can ask for help. These are key. This will get you out of trouble. This is just an advice. It will get you out of trouble. And make sure you're meeting all requirements so that you don't get into trouble. Okay? We're almost done for this portion. There's few laws that you may hear it. Good Samaritan law. This is just a comprehensive review of the legality and then the ethics so that you can have only one place to look at. I'm just giving you everything. I know it can be long, but this is the way one video, you can watch it multiple times. This is a state's law, okay? It protects you in terms of by providing emergency care, outside your employment area. What it means is, this is where people get into trouble. You still provide standard of care. If somebody is choking and you're in a restaurant and he's choking and he's showing signs he's choking, and you got to still have to provide standard of care. You do an MLEC maneuver. You don't just go and what is the best way? Go and start doing chest compression or pulling his leg, checking his pulse in the leg. That's not standard of care. Whatever is the problem, if you're providing that aid, provide it until the standard of care. If even the patient dies, it's fine. You provided the standard of care and you will never be held liable. Somebody is choking and all you're doing was doing a neuro check, well, you're killing him. That's not a standard of care. So that's what they want you to avoid. But if something happened to the patient in the process of providing that emergency care, you will not be liable if you provide standard of care. The other thing too, we saw it in the question, is the patient care partnership information. This sometimes you get confused, people mix it. It sounds weird, but all it means is a document, okay? This is a manual, or it's a manual, and that provide clients rights when receiving care. It's different from your Bill of Rights. It's the innate. This is a document. When you're an institution, they give it to you and said, these are your rights. People are not going to come to your room. They're not going to harass you. They're not going to do anything. You have a right to refuse care and all those things. Those are patient care partnership. It's between the patient and the partnership with the hospital to institute that. Okay. Then few things just to understand about ethics. Okay, ethics. Remember, the code of ethics is just a guide. Okay, code of ethics. This is just a guide for your practice. Okay, for your nursing practice. You can have your own. You just have to follow it. It's a guide. They're not forcing you to practice that, but it's a guide. And it provides you the best standard how to take care of the patient. And this is, like I said, is established by the American Nurse Association, the ANA. You go in, they give you, this is the code of practice, what we need to do. In your hospital, if you have ethics, if they ask you, ethics committee, these are people, the same thing like the ANA, they provide information, but they recommendation. They give you recommendation in situation. They don't make decisions. Okay, they give recommendation to the individual decision makers to decide to do that. That's all they do. They don't impose any decision at all. No. So that's their duties. So this is the legal stuff that you need to know in a brief form. So in your nursing career, there's certain things you have to do. You're a reporter, okay? There's a mandatory reporting you have to do. If you see your colleague doing drugs, please report it. Don't confront them, talk to the immediate supervisor. So immediate supervisor is your best friend. You don't need to prove it. Even any suspicion is enough. If they smell like alcohol, yeah, you can tell your supervisor, say, Mr. So-so-and-so, Miss So-so-and-so smell like alcohol. Can you take care of it? Why are you doing this? Client safety. That's the all. It's not like you want to get to your friend. It's because of the safety of the client. That is the main reason why you're providing this. You also should report communicable disease. There's a bunch of them. I can't list them all, okay? Gonorrhea, syphilis, all those things, chlamydia. So you got to go see CDC and you see that there's a whole list of information, TB, Hep A, all of this, you have to know. There's a bunch of them. You have to go and look at it. Another thing too is suspect of child or elderly abuse or neglect. This is the biggest. You allow suspicion, you see it, you report it. See something, talk about it. And those are the keys. These are the things that you have to do as you go through the process. For neglect and abuse, there is key facts they like asking because it can be confusing. If you see it, you suspect it. Even the suspicion of it is enough. Don't just go and report it. It's not important. Most important is safety and taking care of the patient. So detail history, get a history and assessment so that you can have a proof and provide some safety for the individual. Okay, document, and safety is your number one. In the test, it's a question if they ask you, you will never go wrong if you move the individual away from the person who's being abused, neglected, or anything. Yeah, you just have to move them away. Safety, protect them from harm, separate it, cause security or something from that. You don't need to prove it, like I said. If you have to report it, after you see it, document it. After you document and you provide safety, you report it. People get confused. Who is actually in charge of this? Who is the reporting goal? Is the local authority. Okay, local authority or designated state hotline. They are the one that usually receive the information. Your supervisor, your doctor, they're not going to do anything with it. These are the people. The people you report to is a local authority or designated state. People get confused. You report it to the charge nurse. You report to they're not going to, they too have to report to. It's a reporting problem. Go direct to the source. So local authority, designated state line. Those are the people you report to. In a child abuse, especially, there's few things they like to ask, okay? You have to assess the kid and then look for interaction. These are key. Interaction between the abuser and the kid. Interaction. Observe it. Look for it. They usually like to blame the kid. Yeah. They don't help the kid at all. No help. That's a sign telling you. They don't comfort the kid. That's a sign telling you. They may belittle the kid in front of you. Those are all bad signs. It's telling you, yeah. They can also be uncooperative. In terms of the story, they can lie. Yeah. That's key that you should pay attention. That tells you this person, he may be abusing the kid. Okay. And then you try to get enough information from the kid. The thing you have to do is when you're talking to the kid, communication. Talk to them like at their level. Don't make any promise. Tell them the truth that they may be probably separated from family. Don't lie to them. Otherwise, they will not trust anybody anymore. They tell them that this may happen. They may be separated, and then they will get into trouble. They're not going to get into trouble, but they may lose their parents. But you have to tell them, and tell them that they are not in trouble, and it's not their fault. They need to know that reassurance, but they may lose their parent. They may not go home that day. What are things you should look for? Spiral fracture is always the key that a kid is being abused. If they have burns on both hands, yeah, it's not good. If they have a reddened welt across their back, it's also bad sign. These are signs of abuse, basically, that you should take care of. There's a stigma, though, but sometimes it's true, sometimes, but these abuse risks. So who is likely to abuse people? Low self-esteem. No brainer, right? They may be abused before. They have been abused before. Single parents, sometimes can do that. They may have unrealistic expectation, and that can lead to that abuse. Those are keys stuff. They use substance abuse. So if they give you a question, I say, who is at risk of being an abuser? Yeah, substance abuse. That person is likely to abuse. If they have had domestic violence issue too, they are likely to do that. If they are authoritarian, they can do that. Those are the few things I think you should pay attention. That likes coming. I've seen it before. They like asking you because it get confusing. And the elderly abuse, the risk factors. Who is likely to be abused? So this is the client features to be abused. This one, who is the abuser risk? This is elderly to be abused, or the kid is people who they have female older patients, they have advanced aged, they have like at least physical or mental impairment. And that makes sense because then they cannot do their ADLs. This prevent them doing their ADLs. And that's how they end up being abused. This is the way they get abused. So elderly patient, client, female, usually because men will fight back. So elderly, female, physical impairment or mental impairment, and they cannot perform their ADL. That push them, they have to depend on the abuser to do their stuff for them, and that's how they get abused. Now, incident report. You have to know these are the things that they will ask you. That's why I try to make them short. Incident report. This is key because people make mistake all the time about it. Incident report. Something happened. You give a wrong medication to a patient. Patient fell. Patient had an injury. You got to write a report. First, after it happened, safety and assessment is key. So provide safety and assessment to the patient right away. That's most important, okay? Not go and file the report. No, assess the patient, make sure they're not getting whatever happened, they're not sick from it. You give the wrong medication, you got to assess them to see they're getting side effect. Then you report it to your supervisor, and you file your report. The report is the key, objective and factual. This is not about you, what you think happened. This is objective, factual account of the event. That's all. It has nothing to do with you. You have to indicate what usually happened, the patient statements. So the patient statement, you have to include it. So client report, you got to put it in quotation mark. Okay. You say, they say quotation mark, put in quotation mark. Whatever they say, this is what they say. Any adverse effect to the client due to the event, you have to include it. What monitoring did you provide? Okay. Any witness there? Their names has to be there. Whether you notify the HCP, you got to include it. All of this has to be included. Names involved. The client, their statement in quotation mark, know what they think, what they said, what is what happened. Whatever they said is what happened. Nobody think any adverse effect that happened, any monitoring you, any witnesses, their name and ACP. These people forget. A visitor, adverse effect is also considered incident report. Like a visitor fell in the hospital, you need an incident report. So visitors are also included. They are also included in the incident. They fall, they hit their head, they die, something happened to them, they get shocked or something, somebody beat them. You have to write an incident report. What is the purpose of the report? This is the key. People get confused. What is the purpose? So that they can make sure the same thing will not happen anymore. Okay, they're trying to make sure no repeat offenders. What that means, like that event doesn't happen anymore. And what does that mean? Patient safety. So that we can work on it. And that, but that is number one. It may improve policies, but remember, we can make policies without incident report, right? So that's why if you see policy improvement, don't pick that answer. It's for patient safety and to prevent future occurrence. That's the thing, future occurrence. Okay, that's very important. So number one is future occurrence, not improve policy, not to change policy, but that will come out from it. But number one is to prevent future occurrence. And that is the everything about incident report that you need to know. What if they ask you what is an example of that? You know that, right? Client, we saw it in the question. Client elopement. That's not good. Verbal or physical abuse is not good. If you tamper with the medical equipment, because that can patient safety issue, that also needs incident report. If there's a sexual abuse, yes. Whether involving a staff member or the client, yeah, you need it. If there is a adverse effect, no brainer, right? In terms of treatment, yeah, you got to, it's part of it. Patient fell and hit the head, injury, yes. Any injury related to medical device also need a report. Medication errors need a report. There's a bunch of them, but this is the few I can list for you as part of the incident report. But this is the biggest. What do you include in the incident report? What is the purpose of the report? And give me an example. And visitors are included. Okay. Before that, there's few things I want to talk about. I call this miscellaneous, right? That is impaired co-worker. You can see a question like that. They may ask you, we've talked about it, but impaired co-workers. How do you deal with them? You suspect them abusing drugs or taking drugs from the hospital. It's your duty to report within the code of ethics. You have to report it immediate supervisor. Don't confront the person. It's your duty to do that. Okay, that is the requirement. Why you do it? Client safety. It's for safety of the client. You can't allow a drunk nurse taking care of a patient. Patient die. That's the not. And they can be reported to the state board, like we saw, I told you earlier. Report to, not you, but when they found guilty, report to the state board, and the state board can let them go through the process, drug treatment, where their license can be invoked and taken care of it. How do you know that behavior of substance disorder, somebody who have a substance abuse disorder? How do you know? There's a behavior that they show. They prefer to work in place where there's a lot of drugs. Maybe in the PACU where you have to give a lot of medication, right? They like to work in the night. Not every night that work in the night is a abuser. I'm just telling you, these are some common features. They like to work in the night because there's no supervisors around. So less people at night to be around. Of course, no brainer, right? They smell alcohol on themselves or using strong mouthwash. Yeah, so that you can smell it. That's key. They are frequently involved in a patient who always complaining about pain management. So all their patients always complain that their pain is never controlled because they diverting the drug. They're always falsifying administration of medication to a client. They always get into trouble about wasting. They wasting drug. Oh, they said they forget to waste it, and they waste the drug. Nobody's around. They keep on doing that. There's no witness to and to witness their wasting of drug. That's clue. These are a few things. And the key is they leave the unit all the time, always, and come back in short periods, right? They go leave and go do their thing, and they come back, leave, go do their thing. Yes. It's always a problem with them. So those are the few things I want you to pay attention to in behavior. And the last one, contacting a client about results. What is the method? There's only 3 I'll give you. Call them 3 times. Call, if the husband pick up and they saying things, no, I want to talk to your wife or whoever. If the client is not on the phone, call 3 times, 3 different days or same day, 3 times. After 3, you don't give the message to the husband, it's a privacy issue, right? After 3 times, you don't hear them, send certified mail to confirm that they receive it, because certified mail, you have confirm it. And you can get confirmation that they receive it. If it's still, they never call you back for their results and everything, you call the cops. The police, get them involved, and they will go and investigate about the process. So this is the 3 things I think you need to know. If you see it in the question, that's the process you should follow. Okay, now, number 16. Like I told you, there's 10 more questions. Let's do this. What ethical principle being demonstrated? Hospital decided to ensure smoothly operation in the emergency room by what? Taking intake history based on time of arrival and not insurance status. A bunch of ways, like I told you. Keywords. The hospital want to operate on based on what? The time you arrive, so that they can ensure smooth delivery of emergency care. Not because you have insurance or no insurance, because you go there, there's some people who have insurance sitting there. No. So what are they doing? Autonomy. This has nothing to do with you. They're being good, but they're not harming anybody, right? What they're trying to be is to be fair. And to be fair is to show justice. So that's what they're trying to do. This is the way they will ask you the questions, to use what you know. So they will not ask you what is justice. They want you to demonstrate, right? This is another question. These ones will all thinking questions. Select or apply. 5 clients are in the emergency room. Who can be allowed to leave against medical advice? You know the criteria of medical advice. It cannot be what? Intoxicated. It cannot be at the risk of harming somebody or themselves. They can take care of themselves. They are not in legal old. And then they're competent. They can leave, right? Client with schizophrenia is disheveled and catatonic features. This guy cannot take care of himself. He can leave. Client who attempted hanging episode is suicidal. He can leave. Client with lorazepam overdose is a drug overdose. He can leave. He's impaired. Client who threatened to kill the spouse, homicidal. He can leave. You get the strategy. So those are the strategies I want you to pay attention to. Client with what? Ruptured aortic aneurysm, right? There's nothing, there's no drug, there's nothing. I intentionally left the competent, but all of them are competent, right? All of them, yeah, I left it that to make it vague as much as possible, but straightforward. This is what I give you. You cannot overthink it. Okay. So client with ruptured aortic aneurysm. Is there anything there that tell you he cannot take care of himself? Is there anything he's overdose? He's going to kill anybody or do anything? No, there's nothing there. This client, he can leave if he want to leave. If he want to stay, we'll take care of himself. So that's the problem. That's not a problem at all. So 5 will be allowed. Only 1. Number 18. Select or apply. Which of the following should be included in the teaching? A charge nurse is teaching new graduate about ethical principles. Same thing. You know what it is, right? Which one should be included? Veracity, right? It's not keeping your promise. It's telling the truth, even though if it hurts. Fidelity, you keep your promise. Autonomy, make your own decisions. So this is right. Beneficence, you are being good and no malfeasance. You don't do no harm. So I flip them so that you can know the definition. And this is the way I define it. I don't use too many words to make it easy for you, right? So those are the only one is only one answer. If you pick more than one, you get it. Pick those you're confident. So only number 3 is the right answer. The others have been flipped back on itself. Number 19. What was the purpose of the report? As we've talked about, right? I read from the back, test taking skills. A client fell from the hospital bed and broke the leg. An incident report was filed by the caring nurse. Why was the report filed? Avoid malpractice? No way. Investigate the nurse negligence? We know she's negligent. That's not the reason why. Create new policies? No. We can create new policies whether patient fell from the hospital or not, to mitigation of future occurrence of that nature. This is what all the topic we did. I just want to let you over review it because this is how they can trap you. The main thing was to prevent future occurrence. We can make policies without somebody falling. We are not trying to investigate their negligence. We want to prevent future occurrence. That is the key. Number 20. Which organization was discussed? Which one? A nurse is teaching future nursing school students, future, right? About the organization, look, pay attention, responsible for providing the minimum competency and qualification for nurses to practice medicine. A long word. I said this to confuse you, but to show you how the board can do that. All you need to do is step back, look at the words. These are our words. All I'm saying is which organization is responsible. They're providing you just minimum competency and qualification so that you can practice. National Council License Examination, that's the test you take. They don't provide it. The name of the test you take is that, right? That's the NCLEX, right? Accredited Commission for Education in NC. They give the school names. I mean, they accredit the schools that you went to, so that they can function as a tertiary institution. The word is what? Accreditation. Accreditation, right? American Nurses Association, you know, they involve in your scope of practice. The people who give you the minimum qualification and competency is the nursing board. That is what your test is about, is to test whether you have a minimal competency. That's why they're not making you expert. They're making you bare minimum entrance to the nursing field. They don't want you to like build a house or write a dissertation of aortic aneurysm. No, that's not the idea. It's to make you, just to give you competence, but the competence is the minimum as much as possible, so that they can be confident that when you go to the floor, you make a decision that is enough to save the patient life by being sharp. So qualification. That's all. So D, number 4 is your right answer. They don't want to make you an expert. It's just an entry-level nurse. And the entry-level nurse need a minimal competency and qualification. Number 21. What do we have? What is the nurse's best action? A nurse attempts to give a client with CHF the scheduled digoxin, okay, their medication. The client refused and said, I don't like the way it make me feel. I hate this medication. I don't like the way it make you feel. What should you do? Buzzwords. Patient is on digoxin. You try to give it to them. Say, I'm not taking it. I don't like the way it make me feel. What should you do? Notify the prescriber. What is he going to do? Come and convince the patient? Document the refusal? You have time to do something else. Provide teaching about the medication. Yeah. Give them a teaching. Say, Mr. So and so, this is the why you're taking this medication. If you don't take it, this is what will happen. If they refuse again, then you go and document. But for now, yeah. Notify the charge nurse. He's not going to do anything. Charge nurse and prescriber, what? They're going to do the same thing you're going to do. Come and talk to the patient and say, please take it because it's for your heart failure. Why don't you do that? You are the nurse first before you call them. Number 3 is your right answer. Number 22. Which of the following consent obtained from the client the nurse should consider invalid? This is about consent. I'm trying to get you thinking. Which one is invalid? You know the criteria. A 16-year-old army sergeant with appendicitis, well, is underage, right? Is a minor, 18 years old, less than 18. But he's an army sergeant. He can consent on his own. So this is good. A 15-year-old single for alcohol rehabilitation. Minor, but what? Is asking for substance abuse. Is okay. A 14-year-old single for gonorrhea treatment. STI, sexually transmitted disease. They can do it on their own. They don't need their parent consent. A 16-year-old single for wisdom teeth extraction. This is not an emergency. It does not meet any of these criteria. It's a routine procedure. You can't just go and say, I want my wisdom teeth out. You need your parent permission. This is a 16-year-old. So this patient, we should consider the consent invalid. Number 23. Same strategy, okay? And a charge nurse is teaching new graduate about intentional. You did something, intentional tort. That means you intentionally did it. Which of the following is considered slander? I try to make it easy for you. You know intentional tort is what? False imprisonment, okay? Battery, you assaulted the patient, okay? And I put them as quasi intentional tort. tort, slander and libel or labor, right? Libel law, right? Those two, which one does that belong to? Slander, you talking, speaking. Labor or libel is what? Library. So in the books. This in the books. So written down. Spoken, slander, S. You talk about it. So any of them that I'm talking about them, I'm picking it as an answer. And next, post an untrue story about another nurse on Instagram. Is the word is what? Post. This is a library, so it can be a slander. A unit clerk falsely telling another clerk that the charge nurse is a drug addict. Spoken, slander. So this is good. A nurse telling another nurse about a fight he or she had with the charge nurse. This is the trap, right? There was a fight, and he's just telling you another nurse what happened. He's just telling, he's not slandering or anything like that. We had a fight yesterday, and I'm talking about the fight. I never say forcefully, it just happened. So this is not. A nurse shares the charge nurse diagnosis with another nurse. Think about it. A nurse shares the charge nurse diagnosis with another nurse. I tell another nurse about your diagnosis. I never say it's false. It was a true diagnosis. What are you doing? You're just violating their privacy. You violating HIPAA rule. You're not supposed to share somebody's diagnosis with another person. But there's no slander. I'm just telling them your diagnosis. So the only thing that is slander is number 2. Pay attention to the way questions are said. And then you see that it's easy to pick an answer. Select or apply. 5, client present to the emergency room. Which of the following consent the nurse should consider valid? It's the opposite that we show. So validity, 13-year-old with appendicitis, mother sign it. Is a minor, the mother sign it. It's okay. 75-year-old with dementia, durable of attorney signed the consent. Yeah, it's demented, durable attorney is being can sign the consent. 30-year-old intoxicated is impaired with epidural hematoma, taken to surgery without consent. Yes, it's implied consent. It's valid. Imply because the patient is impaired. He can't do that. And the patient, if we don't do anything, is going to die. Epidural hematoma, he will die from it. This is a bad diagnosis. So you're looking for a bad diagnosis that if you don't do anything, patient die. A 45-year-old comatose badness with abdominal bruit, taken to surgery without consent. These are the things you have to think. I did this, it's like a case form for you. This is the buzzwords in the case form. A comatose patient with the bruit, this is a AAA rupture, triple A, aortic abdominal aneurysm rupture. There's a bruit there. And because his comatose is bleeding, he's going to die. We got to take them to surgery. This is fine. 25-year-old intoxicated with ankle fracture, taken to surgery without consent. This was a trap. We got to call and see if we can find family. This ankle fracture is not going to kill them. It's not something that will kill them. So we have opportunity to call. I have to say, consider that I have to ask the doctor, hey, this is ankle fracture. Let's find the doctor, hey, next of kin, parent, or anybody around to see who can sign. He's intoxicated. He can't do that, even though he's not a minor. The parent or the wife or somebody has to sign. But we got to contact next of kin, parent, and see if they are available. So this one is not valid. So 1, 2, 3, and 4 are valid. And the last one, select or apply. And nurse is teaching new graduate about HIPAA law. Which of the following must be employed under HIPAA to be considered an incidental disclosure that must be included in the teaching? a bunch of words. When you see this, they're trying to trap you. Step back, look at it. They say HIPAA, but which one can I do to ensure incidental disclosure? That means I can violate HIPAA law and I consider it as incidental. It happened accidentally. I did not plan to expose that individual variable information. But if I make precaution for that and it happened, I'm good. If you use curtain and the roommate hear it, you are good. Use curtain in semi-private spaces. Yes. List names on the whiteboard at the nurse station. That means nobody can see it. It's between the nurses themselves. The public cannot see it. That's good. Communicate in lower voice in semi-private room. Yeah, I can't block the other roommate here. I'll speak in lower voice. If you hear me at all, that's fine. I'm still not violating the patient. Communicating whiteboard at places least visible to the public. Yeah, if I'm writing names of the patient, it should be far away from the public as much as possible. Tell roommates precaution to take in semi-private room. Yeah, if we are in the room and you have flu, I can tell you wear a mask. Your roommates, you need to wear a mask. He's getting sick so that you don't get sick. We should be fine. So all of this can be employed to consider incidental disclosure. This is the end of it. Comprehensive ethics and legal review with the 25 questions. I know it's long, but I just want to make one video. So take care of yourself. I hope this video is helpful and serves as a resources for you. If you have not subscribed, check the subscription down and click it so that you can get more videos when I make them. Take care of yourself and good luck in your exams.